What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Question for the tribe. Question for all my nurses out there. When you are not the nurse, you're the family member or friend who's visiting a family member or friend, and the provider or the nurse or some medical professional walks in the door and starts giving information, do you introduce yourself as a nurse or do you keep it on the down low? Why or why not? We could stick to the scenario of you being the family member, or the son, or the daughter, the aunt, or the uncle, or you could be the niece or the nephew. Take your pick, however you'd like to play out this scenario. But when the medical professional is in the room talking medical jargon, do you introduce yourself as a nurse, or do you kind of push that to the wayside until maybe that question comes up? Or after your family member already introduces you as the nurse, because that happens all the time. I've kind of taken the approach of not explicitly saying that, because it usually causes the medical professionals to act differently. Both good and bad. Usually when I tell them that I'm a nurse, or if I tell them I'm a nurse practitioner, oh ho ho, you're an NP, well, And I kind of don't want that to happen. But on the other hand, I want to tell them I'm an NP, that I'm a nurse, so that they can talk to me in medical speak. They don't have to dumb it down for me. Just give it to me straight, what the hell's going on? Instead of giving it to me in big, large lettered words that you find on the internet. Just tell me what in the hell's going on. Medical terminology, let her rip. It usually is met with resistance in 50% of the cases. For some reason, nurses, other NPs, physicians, providers, they 50% of the time they get kind of standoffish, because all of a sudden there's someone else in the room that has a degree or has a, I don't know, is part of the medical profession. I don't know. I wonder if they feel threatened. Do they feel like, they're being watched like a hawk because I know if they've done something wrong or there's a mistake made? I mean, anybody, a nurse, anyone, as opposed to a non-medical professional who's a family member. I'm curious. What has been your experience? I usually start off with not introducing myself, not making it known that I'm an NP, and then through the course of conversations, maybe over the course of a couple visits, it's discovered or it's explicitly told that, I'm an NP, and things usually change, both good and bad. And I wonder why. I mean, I know that when I'm taking care of someone who has a family member who's in the medical profession, I probably subconsciously act a little differently. I'll admit that, because you're on your toes. You want to make sure you don't screw up. And quite honestly, sometimes it's just a professional courtesy. You're trying to give the very best care to someone else who walks in the trenches with you, maybe not in your facility, but they know what you go through. So, you want to, it's a certain amount of respect, maybe? I don't know. I'm rambling now. Curious. What has been your approach, and why or why not? Leave your comment down below. You know your comments are my caffeine. Share this with somebody. And as always, check your own pulse first.